this problem of diarrheal disease at Katbon jetty as well as Mobar jetty. Now, till date, we have got 172 reported cases, and to tell you how many are admitted right now, South Goa District Hospital, Hospice of Madgaon, we have got 7 patients admitted, and in GMC we have 12 patients admitted. We really don't know whether it is coming down, but then definitely our admissions have gone down, because at a time the maximum peak number of cases in Hospice or South Goa District Hospital have gone even to 30-35 patients at a time in a ward. So we have even kept them separately in a cubicle, and we have identified even separate toilets for them, so that there is no spread of this infection to other patients as well as to relatives. So even the cleaning in that cubicle, cleaning as well as even in the toilets have doubled. Before it was happening 3 times in a day, now it is happening 6 times or more than 6 times in a day. Now even whatever infection control practices had to be taken in the hospital, all those are taken. Now at the jetty, what is happening is now these people being laborers, fishing laborers, they are going at sea for 2 days to almost 7 days or sometimes more. So we have prepared a medicine kit for these people, which has ORS, paracetamol tablets to prevent vomiting, as well as antibiotics. So what we had seen before is people who get sick at sea, by the time they come back to the jetty, it is 2 days or more. So they go more worse, they go dehydrated completely. Although from day one we had given them ORS, all the boats, all the boat owners, everybody, but then only ORS was not helping. So that's why in that kit we have added even antibiotics, so that anybody who's getting sick at sea with vomiting or loose motions, they need to be started on these antibiotics immediately, so that the dehydration is less. All other services which are there at Primary Health Center Baldi as well as at District Hospital, we have enough antibiotics. We have even what is required is IV fluids and ORS. Even this is there in enough quantity.
You spoke about 172 cases out of
172 is total from Mobar as well as from Katwan jetty, both the places. Now there are a lot of people who have taken treatment and they have they are not admitted, non-admitted patients also. Like even as of today, there are almost 33 patients who are taking treatment and they are there on the totals.
But total workers, how many could be there?
That is up to the fisheries. But then roughly around 3,000 or more than 3,000 will be there.
What about the other jetties? Is this restricted only to Kudbana?
This is, as of now, it is restricted only to Mobar and Katbona. Okay? But then we have given instructions to even keep an eye or keep a vigil on all other jetties.
All other jetties.
So right
Testing.
now, the number of workers affected is around
172.
172.
And test conducted?
See, it is not about test conducted. It is diarrheal diseases. So whoever has come to us with vomiting and diarrhea, we are listing them out and we are treating them with antibiotics. Now test check asa paini. In an outbreak, we don't go to test everybody. Then you misuse your resources. So once we have tested and we know that it's cholera, we don't have to test everybody. So the tests which will be done are basically to see them that they are well. म्हणजे त्यांचे इलेक्ट्रोलाइट्स करता, त्यांची किडनी फंक्शन टेस्ट करता, त्यांचे ब्लड टेस्ट करता, बाकीचे टेस्ट दॅट इज मोर रिक्वायर्ड.
टेस्टिंग अजून चालू आहा तिका न्हू कुटबाणो जेटी
कटपुना जेटीचेर जे आमी न्यू लेबरर्स आहा ते टेस्ट करता न्ही इज मोर फॉर युअर मलेरिया दॅट स्लाइट टेस्ट विच वी डू. बट देन आवर पीपल आर देर एवरी डे देर. सो एनीबडी हू इज कमिंग देर विथ सिम्पटम्स ऑफ डायरिया, वॉमिटिंग, दे आर बीन गिवन ट्रीटमेंट एंड दे आर बीन असेस्ड वेदर दे हॅव डिहायड्रेशन ऑर नॉट. तांकां जर डिहायड्रेशन आसा जाल्यार आमी तांकां मागीर रेफर करता डिपेंडिंग ऑन सिवियरिटी टू PSC बार्ली और आमचे डिस्ट्रिक्ट हॉस्पिटल.
What could be the major cause of concern for all this in this issue?
See, the major cause of concern, at least from health side, is there should be a good sanitation. And now sanitation means toilet services, because all diarrheal diseases